decide whether or not we want to choose an orthopedic surgeon that is employed at an academic medical center and works as academic faculty for that academic medical center, or someone who's in private practice. When choosing a surgeon who works in an academic medical center, there are a lot of pros, which are that orthopedic surgeon is almost always on the cutting edge of orthopedic technology, access to the best instrumentation, constantly learning more and more cutting edge material, and at some point, sometimes teaching themselves, which puts them in a strong position where it demonstrates that they know what they're doing. It does not imply that the surgical skill is good or bad, outstanding or poor. The expectation is that it is at least average, and that's fair, and that's good. One of the potential cons of working in an academic medical center is that the patient is not aware of exactly how much of the surgery is being done by the surgical attending versus the training doctor. This is academic medical centers train residents and fellows, and that's fine. That's a good thing. It is important, however, for that patient to be aware and not afraid and be able to ask the proper questions. For example, are you doing the case, doctor? Or are you committed to doing as little of the case as possible where your resident or fellow is doing the case? The best answer for that would be we do the case together and I allow the resident or the fellow to do whatever I think they're ready to do. And the question can be, are you always in the room? And the answer should always be, of course I am. So that's one thing. Another is the anesthesia. There are anesthesia residents who are being trained as well. So it's important to make sure that the patient is comfortable with the fact that anesthesia is undergoing training. So the better the quality of academic medical center, the safer it's going to be, the less complications there are. So when deciding about an academic medical center, I always highly recommend that it's considered one of the best in the country, if possible. And in my area, we've got a lot of places like that. With private practice, the pros are that it's more of a hometown feel. It's not as unionized. It's not as large. And so some people prefer that smaller feel, especially solo practice, which is uncommon. And so that's nice. People like that. They enjoy that kind of feel that is given in a smaller private practice opposed to a large hospital setting. The cons are that some of those private practice orthopedic surgeons have nobody watching. They're not teaching anyone. They are not necessarily staying sharp and on the cutting edge, which is also fine because we do, in order to be board certified, take exams every 10 years to make sure we're board certified. But it's possible that the techniques that surgeon is using may not be up to date, or they may not be as sharp. The best timing for how many years you want your surgeon to be in practice varies depending on the case. It depends on the surgeon. So all these things are great factors that one can use. And there's no right or wrong. There's no best. Like I've said, the most important thing is how do you feel about that surgeon after you've met with him or her?